Welcome everyone. I'm Aster Vas, and today we have the pleasure of hosting Dr. Kapadia, a foreign trained dentist who successfully navigated the rigorous journey of getting into the Tufts University. Her story is not just about perseverance, but also about learning and adapting through challenges. So, Dr. Kapadia, thank you for joining us today, and you can take over. How are you feeling, and how has it been that you've started the school lately?
Yes, thank you, Dr. Esther, for inviting me and allowing me to share my journey with all the aspirants. I know how it feels like when you are on the other side. Like just a few months ago, I was also one of the participants who would be like listening to someone who would be sharing their thoughts. So I cannot just, wait to share my journey with you all. So, my orientation at Tufts University actually just got finished in December, and then I started my school like this week. So it's just been 2 days since I started the school, but I think putting my foot into the door as a dental student in the US is like it has always been my dream, like many, and then it feels really incredible, and I'm so grateful that all the people I have met during my journey who supported me. That's why I'm here today. So thank you to everyone whoever has supported me. And yeah, I'm like happy to talk about my journey. So I graduated from my dental school in India back in 2014 with BDS. And then I actually worked at a non-profit organization for 1 year, and then two private practices as an associate dentist for another year. And in between that, I decided to pursue my Master of Public Health in the United States. And then the reason was for that is like while I was practicing as a dentist, mainly at a non-profit organization, I saw that that organization was located near the rural villages, which was connecting like five villages close by, and people were coming there, and we were providing like mostly very low cost treatments. So then, even the treatments were so low cost. Many people were not really happy with how the oral health should be, and then even if like we could save the tooth and we would obviously recommend them to go with root canal treatment, they would always opt for extraction. So and then with that, I was able to explore the social and behavioral determinants of health, and how everything needs to be connected, because it is always about overall health. So then and then during that time I also took some C courses, which also connected me with like dental technology. So then I moved my focus to the United States to understand that how the healthcare works here in America, and then simultaneously, like I could see the advance and progress of the dentistry over here. So I decided to pursue Master of Public Health, and then I moved in 2016. In my first semester itself, like I had courses like Introduction to US Healthcare System and Social Determinants of Health. So they were like a pioneer of me understanding actual healthcare in America. So, and then during that time, I also started looking for dental shadowing opportunities. So here, I actually want to tell the participants that always network, because the way I got my first shadowing opportunity was like our school. I'm sure some people who have MPH may know, like if you are in MPH school, then there is like National Public Health Week. So then I met a dentist from NYU who was there attending that National Public Health Week. And then I was actually one of the representatives over there. So then I met her, I talked with her that I'm interested, I'm a foreign trained dentist. And then she actually got connected me with her husband because they have a practice in Queens, New York. So then That's how I got my first shadowing opportunity. So then it was like really out of the blue. I never thought that it would work. And then she has been so kind that multiple times I went to meet her at NYU. I also I'm also still in touch with like both of them because they have been really amazing, very supportive. So you never know where you can find your opportunities. So just like try to go out there, talk with people that what you are looking for, and then you never know what clicks.
Yeah.
And then during my MPH itself, like I completed my part one, and then I graduated in 2018. But now I needed to like focus to my work, finding work opportunities as well to stay in the United States. So then I started looking for jobs, and then I needed to get like non-dental jobs because to get like work visa, it has to be related to your study major. So then I got my first job mainly in like healthcare, where I actually learned how the electronic health record system works, and then how the insurance work, and then that experience was really good for me because I learned inside and out about Medicare, Medicaid, and all the insurance system, how it works in US. So that was really helpful. However, during that time, I did not stop myself from pursuing dental opportunities because I had Monday to Friday full-time work, but then I was still like trying to go for dental assisting over the weekends. So if you are pursuing dentistry, then it is really important that you stay connected with dentistry in one or the another way.
Yeah.
And then I also completed my part two, but again, like I completed that back in 2019, and then I started applying. My TOEFL at that time was not 100, so then that was a mistake, I guess. That's what but I really wanted to see like how the application works. So then I still applied. Yes, it did not work for me. It could work for some people. No, I think it depends on like how each person's profile, because at the end of the day they do look for holistic profile. However, competition is more and it is increasing year by year, so it is really important that you really have a good TOEFL score. And then so at that time nothing worked, but then I continued my community service experiences, dental or non-dental, anything. Then in 2022, I did my preceptorship at Boston University for 1 month. I did have like dental assisting experience in a private clinic setting. However, I wanted to see like how it works in academic setting, how the students work, how the student clinic operates, how the operation of like faculty and student work, because some things are different the way we have approached in our home countries. So then I really like before we start the clinic, faculty and the group practitioner here, like each student group has a group leader where they call here group practitioner, or like a practice leader or practice coordinator. Each school may have different names. So then what I saw is like each morning before starting the clinic, they would do the huddle, like what each student is going to work on their patients that day or in that session. That was really good because at least that practice coordinator would be aware of what his students are doing, and then that's how he would approach like treatment and treatment steps, and make sure that they would complete in that particular session.
Yeah.
That was really good. I also enhanced like so many skills, like, how you would assist in student clinics, because when you assist dentist in that clinic, definitely you are very good. But then once you become a student, you also need to learn some really detailed technicalities, because once you become a dentist, sometimes it happens that you may skip a step because you need to get the procedure done, but that at school that's not allowed because really need to get the approval of your PC. So then I really learned those details, and it was a really good experience for me. However, it was just 1 month. So then, and I continued my dental assisting and my job and everything. And then going, and then yes, during that as well, I took bench prep course. Definitely, it is not mandatory. However, I was away from my hand skills for a long time, so I really needed someone's guidance where I could actually prepare the hand skills, where I could make sure that my preps are well, and then it's really up to the mark. So then that's why I opted for the Dr. Duggan's bench prep course. And then that's when I received like invite from Virginia Rental School. And then that was like they had almost like 8 hours of bench test. And also that bench prep course was really helpful for me. I did not get selected for that. However, like it was a really good practice for me that, oh, yes, this is how the bench tests are getting conducted at dental schools. So then, and each interview teaches you something. So really don't get disappointed. Like if you don't get into the school, yes, it is. I'm sure like it is very disappointing, but try to look at the brighter side, that what you learned from that experience, and try to improve your mistakes in next time that you get in. And I really hope you all get in very soon. But I think that's what I kept learning from my mistakes.
Since you've already walked us through how you began with your application cycle and your approach to TOEFL, INBD exams and all of that, you did tell me earlier about your story of applying 5 times before you received acceptance, and that is a testament to your resilience. So, to touch upon that, could you take us back to your first application cycle? What challenges did you face, and how did you feel during that time?
Sure. So when I applied for the first time, I think the way I approached is that, oh, this is how the application cycle works, and then not understanding how big the applicant pool would be. Then, we may just think that, yes, even if we approach like our seniors or friends, mentors, whoever may be in this boat, they would definitely advise you. And then I was like, yes, everything looks good, and I would just apply. I want to see how this works. Then I actually applied, I think back in 2019. That was probably like one or two schools I just applied. I just wanted to see. However, I guess I should have waited and then, maybe be more prepared and then try applying. I'm not saying people here should not try, but then if you feel that if you are lacking in one area, be it like TOEFL score lower than 100, then I think if you think that no, I definitely want to try after I take the TOEFL of more than 100, do that. And another thing is, I did not apply early. Like when I got accepted, my application, like this year, back in 2024, application cycle opened on, I think, 7th or 8th March, or maybe 9th March, I'm not really sure. But by, if I talk specifically about Tufts, my application completion email I received on 21st March. So like within 2 weeks, I made sure that my application is with them. And then whichever application needed supplemental essays, make sure that you complete them by at least, mid-April. So that's what I put emphasis, that early application is the key.
Okay. And like after facing rejections, many might consider like giving up. So what motivated you to keep trying, and what steps did you take to improve your application with each cycle?
Yeah, so each cycle, I think it is very important that you evaluate your profile on where you are lacking or what you need to do. So when I did not succeed in my first cycle, then COVID hit. So then I tried that, okay, with virtual opportunities, what I should do. So then I tried to, definitely dental assisting shadowing was restricted. Then I tried to look for community service, but which was virtual. So then, there is volunteermatch.com, I think, where you can find in person or virtual volunteer opportunities. So that's when I got connected with one organization which in California that, supports women who have been a victim of human trafficking. So then that was a short span, but I actually became like the research analyst where um, I could, organize or compile the data of like all the victims and make the list, and then when our hotline like calls, and then how to respond them. So that was like really, good for me. And then I actually learned some different side, so I feel that it was really good to get involved in dental and non-dental community service. I think we just need to find opportunities and maybe change our approach depending on the situation. So even in 2020, like I applied to 5 or 7 schools. It did not work, but I actually put in a lot of hard work for like supplemental essays. So definitely that was like not the outcome I wanted, but still like I just looked at the bigger picture. Like I needed to see that why I came to the US in the first place. And then yes, it actually kept me going with my family support.
Yeah, I mean, from what you're saying, I understand that it is important to not just be doing dental related volunteering, but also keep yourself with community outreach programs and stuff. So you mentioned about this place that you volunteered in California. So did you have to be there in person? And if you could name that organization so that the ones listening can like also know what opportunities are out there in California would be great.
Sure, sure. No, that was virtual actually because at that time I was based in New York, New Jersey. So that's why
Okay.
like that was virtual. And then I think the organization name was FAST, Family Against Sex Trafficking. And
Okay.
I actually found that through volunteer match itself because they will have like list of opportunities which you can do virtually, and then you can just, I think they may have email or something because I reached out to them via email. So you can find out such opportunities online and then reach out to them via email expressing your interest and then how your background may fit with their needs.
Yeah, I think volunteer match, not just in virtual, but you can also like kind of see what kind of opportunities you're looking for, even if it's in person. And I think that website is really a good way to also understand what opportunities you have around your area as well. So, can you share your specific areas where you worked between your cycles, like about enhancing your resume or clinical skills or interview techniques or anything on those things?
Yes. So when I talk about like improving my profile each cycle, whenever I approached people, they are like, "Oh yes, you have lots of experience. You have this and that." I actually like change my personal statement every cycle. Every cycle, I feel like yes, this is good, but definitely if the school doesn't like it, then maybe that's not good. So then I tried to change my approach every cycle. For improving my profile, like I mentioned that I did have one preceptorship that was back in 2022. However, I still felt that if my experience is like of a limitation because I do have like non-dental experience more due to visa constraints, I need to do something which can actually, make me connected with the dental field as well. And back in 2023, I opted for another preceptorship that was in UCSF, and then I did that preceptorship from, I think, April 2023 to June 2024 until I got accepted. So, more than a year, I did that preceptorship that was in AGD department. I learned a lot during that preceptorship. Like, I cannot even explain because every day, like, and that this was while I had my full-time job. And fortunately, at that time, like, I switched my job and then I did get like virtual job. So, thankfully, everything worked out for that. But yeah, during that, like, that was in AGD. So I worked with residents and faculty. So that was not just limited to pre-doctoral students, but now I was actually assisting faculty and residents. So then That was also really good experience because usually as a pre-doctoral student, you do not get like too many root canal treatments or anything to do. But with residents, I get to like assist in those procedures.
Yeah.
With faculty, the best part was that the faculty was also teaching me like when they were doing crown preparation, so
Mhm.
then that was really good. And then I also get to make like clear aligners for patients like night guards and something. So then I also got to like, explore that part of the area in the lab and everything. So then I feel like that was like a really good experience. And during that I also had an opportunity to get involved with research. So then, before starting the preceptorship, I just want to say this because doesn't mean that if it worked for me would work for you, but you should just try what works best for you. So I was interested in research because I got introduced to it in my public health, and I also did internship in research, but that was non-dental. So I always wanted to do dental research. Before landing an opportunity in 2023 for research at University of Michigan, I emailed minimum at least 70 to 80 professors in the whole US at every dental school. Like I did not leave any, and I was ready to move wherever I could. And then even at two dental schools, it was about to like work out. I also signed the paperwork, and then they already told me like, okay, maybe you could start from like next month or something. And that's when they got back to me that, oh, actually university policies have changed. So that was like so disheartening to me. However, like just keep approaching people, like if any experience that you think that you would want to like pursue. So yeah, I mean, I feel like I wouldn't change this even a bit, because it definitely teaches you something.
Yeah. I mean, after such a challenging journey, you finally got accepted. Congratulations. And what made Tufts University stand out among other schools for you, and why did you choose it?
So, last cycle, I would be honest that I actually got an interview from Tufts University. So, and again, like I was in Midwest when I actually received an interview, but I have heard a lot good things about like Tufts University. So, I have had friends who have attended that in past, and they spoke highly of the university in terms of like how the program director takes care of each and every student, not even like as a candidate when you are there for interview, the students take care of you like as if you are already a part of their family. Like when I went there, the school tour and everything, the students were just telling us that, oh, I have confidence in you guys, that I'm sure like you all will do great. And the way they motivate you, the director is so good. And then even if you get accepted, it's like it feels like a family. And then our director like kept checking on us like by calling us like how we are doing until we started the school. Even now they are checking on us. So I feel like it makes it unique that even the program director is actually checking on you, how is everything going, even if it is personal, like if we found the place apartment, if we need any help, then he can help get us connected. So I feel that it is not just like a class or school anymore. It is like our family. So that actually, make the school stand out. That's what I can say.
Okay, and I heard that like Tufts University is one of those which invites you first for a bench exam and then for an interview. Is that true, or could you like walk us through how is that process?
Sure. So, actually, this was my first time applying to Tufts Dental School because until now they were only accepting green card holders or citizens. But
Yeah.
from cycle of 2024, they started accepting like visa holders as well. So then, Tufts University does not have a batch test, but the way they did it for us, I don't know if that could change in 2025. But the way they did it for us is like first you have to like do the Kira. So they will send you the list of recorded questions, like how you have Kira with other schools, that the question would be recorded and you will be given like a couple minutes to think and then couple minutes to answer. So we had like 10 questions on that, and then that was the first round. And it was not like if you get selected, then you would move to another round, but basically each candidate has to complete the three components. So this was the first one. And the second one was in person, where we would have like two or three exercises in that. So there would be like a preclinical part where you have to like identify the bench preps and then see that if there is any mistake, or
Okay.
what could have been better for that specific prep. And so that was one component. Another component is that you can get a PowerPoint presentation where you could have the like list of questions, and then that would be like a multiple choice questions, and they could ask you anything ranging from dental material or instrument or anything, and then you'd have to identify that. And then the last would be like with the director himself, and then that was like, I'm sure like when people go for in-person interview, that would be like very stressing. So that was really good actually. Like it was mostly like the way we had like conversation. And then also like if people thinking here are, it doesn't help, it's fine, we don't have bench prep, that's okay. That's fine. But what happened with me was that my director asked me that, have you had any hands-on experience? And then that's when I was able to show him the photos of my bench preps. So then that really helped me. So that's when I thought that even if the school does not have a bench test, but then because I practiced, that really helped me to show him that this is what, like, I have. So that was really helpful.
Yeah, I mean, thank you for clarifying that and walking us through the whole process. I think, even I must have misunderstood it with another school, and it's really nice to know about how Tufts University does it. And for those listening as well, it's a great information. So many foreign dentists are tuning in today and who are might be facing the similar struggles like you did. So if you could give one piece of advice to someone who has faced rejection and is considering reapplying. So what would that be?
So, if you are considering reapplication, I would say that application cycle starts in March. Start preparing your documents from now. Please try to approach your recommenders now that you will be applying. You would want your application to be ready in like first week. So then, please help me submit my recommendation letters as soon as possible. If you need to get back from your home country, start your process now. And another thing is, this process is very overwhelming, and I totally get like how we may feel anxious while we are waiting from the school. Have the support of your family and friends and whoever you can talk with, and try to live your life. Don't stop living your life. It's okay to go out. Don't just work on one single thing. Take a break if you need to, but be refreshed, be recharged, and just be ready. I'm sure like you all will ace it. But yeah, try to make sure that you have like a good state of mind when you're trying to submit the application, because you cannot, like, once you submit, you cannot edit it. And then work on your documents with the help of your seniors, friends, mentors, whoever can help you. But yeah, start your application documents from now.
Dr. Kaparia, thank you so much for sharing your journey with us and sharing your wisdom as well. Your story is truly inspiring and definitely a testament to your perseverance and growth. So, before we wrap up, I want to share an exciting opportunities with our audiences and those listening. As part of the DSS Ambassadors Initiative, Dr. Kapadia has graciously offered to mentor students who are interested in navigating this journey to getting into the dental schools in the US. So, this is a wonderful chance to gain guidance and insights from someone who has been through the process itself. So if you're interested in being mentored, I'll be sharing an application form in the chat box. I've already put it through. So please take a moment to like fill it out after the webinar, and we would love to connect with you and the mentors who can support you on your journey. So once again, thank you, Dr. Kapadia, for your time and being a part of this initiative. And thank you for everyone who have joined us today. Stay tuned for more webinars and events with Dental Student Society, and have a great day.
Thank you for what you are doing. Like, really appreciate it. It's like really great for all the applicants. So, and thank you for inviting me, and all the very best to all of you. Please feel free to reach out if you have any questions or concerns. Thank you.
All right. Thank you so much. Bye bye,
Thank you.
everyone.
Bye.